I'm Dr. Matthew Newman. I'm one of the pain management physicians here at the Spine Center in Baton Rouge, and today we'll be talking about sacroiliac joint-related pain. The sacroiliac joint is abbreviated as SI joint. It's one of the most common ways of hearing about this joint. It's a long, flat joint at the bottom of the spine where the sacrum, which is the tailbone, meets the hip bones, which is the ilium. So how does the sacroiliac joint cause pain? Well, it's more of an alignment issue rather than an arthritic issue in a lot of patients. I typically say that whenever you walk, the SI joint, it does this, and it does this, and it can get thrown out of alignment very quickly. Common things that can cause it are lower extremity injuries, say if somebody had a previous knee surgery, ankle surgery, broken hip. Something as simple as tight hamstrings can cause an alignment issue. There's plenty of ligaments, nerves, muscles all around the sacroiliac joint. Those can cause a lot of pain. So we like to kind of focus in and try to figure out, number one, is this the correct diagnosis? And number two, what can we do about this? We typically start with a round of physical therapy, a home exercise program, stretching hamstrings and other low back muscles to alleviate the pain. If that doesn't work, we can try a combination of oral medications that are non-opioid, something that's not going to cause issues down the line, and also a series of injections. So an injection can be an alternative to a surgical procedure. There's no recovery period after an injection. Sometimes these injections can provide years worth of benefit, and that's an excellent response. It's certainly a good option if patients are considering non-surgical options. An injection's done in our facility at the Spine Center under live x-ray guidance to help guide the needle in the exact position to alleviate pain. Typically this is done as an outpatient procedure. You're able to go home the same day. It takes 5 to 10 minutes to do an SI joint injection. It's very easy, very safe, very straightforward. Typically what's done in an injection is the patient's laying on their stomach under the live x-ray guidance. A very small needle is used to introduce local anesthetic medication to numb up the area completely before introducing a slightly larger spinal needle into the SI joint. Then a mixture of steroid and more numbing medication is then injected into the SI joint, and the patient is sent to recovery room, monitored for about a half an hour, and then sent home. The injection takes about 2 weeks to kick in, and it can last anywhere 3 to 6 months, sometimes longer, depending on the pathology and depending on the patient's response. One of the convenient things about sacroiliac joint injections is it can be both diagnostic as well as therapeutic. If a patient receives benefit for many months after an SI joint injection, then we know that that's the pain generator in that patient, and we can repeat the injections as needed. If a patient's had a series of injections and the injections have been beneficial in the beginning but are no longer helpful, we can actually do a non-surgical nerve burn called a radiofrequency ablation. And what that is same as the SI joint injection. It's done as an outpatient procedure. It's covered by insurance, and the nerves that innervate the SI joint, the nerves that are responsible for sending the pain signal coming from the SI joint to the brain, are actually ablated or burned with a very simple technique with a needle with a wire through it. What that does is it de-innervates the SI joint and eliminates that pain signal going to the brain. That can last anywhere from 6 to 18 months, sometimes longer, depending on the patient's response. If you're wondering if your SI joint might be the cause of your low back pain, call us or visit our website to make an appointment for a thorough evaluation.